Have you been noticing those smile lines creeping in? If they're starting to bug you, stick around because I'm diving into the best ways to improve them. I'm Dr. Sam Ellis, and I'm a board-certified medical and cosmetic dermatologist in Northern California, and I'm here to help you understand your skin and find products and procedures that work for you. So if that sounds good, give this video a thumbs up and don't forget to subscribe. So first of all, what are smile lines? They have a lot of different names. We call them nasolabial folds or melolabial folds in the dermatology office, but they are essentially the folds or creases that extend from the base of your nose down towards the corners of your mouth. I really wanted to address this topic of smile lines or nasolabial folds because it's one of the most common things that comes up in my cosmetic consultations with patients. And it's one of the first things that comes up, even for my patients who are in their 30s and 40s. One of the earliest signs of aging that they start to not love about their face is these lines. And usually those lines aren't particularly deep at that point, but it's the first thing that makes a person go, oof, I don't love these changes that are happening with my face. And I think before we dive into the ways that we actually treat them or improve their appearance, it's really important to understand what causes them, because if you don't understand the cause, it's very hard to find a solution. So these lines have a wide variety of causes. A lot of people refer to them as smile lines because when you smile, you can see where you're creating a crease. And as you smile over your lifetime, that's going to etch that into the skin more. And we see these lines kind of advance into a full-on fold as time goes on for several different reasons. Aside from the repeated muscle movement of smiling, you also have the issue of gravity and the descent of the facial tissues. Over time, unfortunately, your skin loses elasticity and becomes more lax. And as it starts to fall, those lines get emphasized. The descent in facial tissues and the overall change in someone's facial shape is very much a hallmark of getting older. When you look at people who look youthful, or you can easily identify that person as looking young, they often have more volume in the top half of their face. But as time goes on, those tissues begin to fall and we begin to accumulate more fullness in the lower part of our face. You'll notice jowling along the jawline and those nasolabial folds getting much worse. But in addition to that volume shift, we also have a little bit of volume loss in this area. And I see this in women much more than men, but as women, we lose bone density as we get older, and we actually lose volume of bone in our skull or in our face. And when that happens, the maxillary bone, which is this bone that kind of extends here and gives you a cheekbone, starts to shrink down. And when you lose that volume there, it actually loses support at the base of the nose, and your nose starts to fall kind of back into your face, which can really emphasize those lines. Also, with regards to shifts in volume, if you lose weight, you often will notice an emphasizing of those smile lines because fat in the face acts as a support structure. And when you lose that fat, lines become emphasized. I happen to be seeing a lot more of this these days in the Ozempic era. A lot of my patients are losing weight and losing large amounts of weight. And one of their biggest complaints is how much older their face looks, and specifically how much more their smile lines have become emphasized. And then of course, aside from the volume component of your smile lines, there's a genetic component. So how your face ages is very much determined by your genetics. And some people are more prone to developing smile lines than other people. And of course, I would be remiss as a dermatologist without talking about the quality of your skin contributing to those lines. As the skin ages, it's going to thin out a little bit, it's going to become more dehydrated, and that's going to make you prone to having those lines settle in. And things that can emphasize that or expedite that process are UV radiation and smoking. Another important cause of these smile lines is something that a lot of people don't think about, but when I point it out to them in clinic, they're like, oh, that makes so much sense. And that is side sleeping. The reason for that is when you sleep on your side, you kind of smash your face into a pillow. And if you naturally have a crease forming at your nasolabial fold or along your smile line, that is where your skin is naturally going to collapse on itself, and it's going to emphasize that line while you sleep. And when you think about it, I mean, depending on how much sleep you get, that's 6+ hours of just etching in that line every single night. All right, so we know all the various causes of these lines, but what can we actually do to improve them? Let's first talk about things you can do at home. And I would say these at-home interventions are really there to help with the skin quality. So rather than fixing really deep smile lines, the at-home interventions are more there to improve the quality of the skin so it's less prone to creasing. I'm not sure I do a video on here where I don't sing the praises of sun protection and topical retinoids, but those are the two holy grail things that you can do for your skin to keep it as supple and youthful as possible. And the more collagen you have in your skin, anywhere on your face, but particularly in this sort of like cheek cheek upper lip junction, the less prone it is going to be to creasing and folding over time. In terms of at-home devices, I think there are a couple things you can think about using. One is an at-home red light LED mask. Now, of course, you can do red light treatments in the office as well, but just the convenience of having this at home can be really nice. I have a whole video dedicated to the benefits of red light, so you can check that out. But essentially, we are using red light and near infrared light to stimulate collagen synthesis within the skin. I've also had patients over the years who have really found benefit using at-home devices like the NuFace or other microcurrent devices to get some modest tightening around their cheeks and jawline. And anytime you are working to sort of like lift and tighten the cheeks, it's going to alleviate those folds, because remember, it's due to descent of the tissue. I always remind people, if you are investing in these at-home tools, you have to know thyself and whether or not you're actually going to keep up with it. But two, you need to keep up with it in order to keep those results, because they are modest results. These are not super powerful devices. And so it's about little incremental improvements every single day. Also, for these smile lines, I actually think this is a place where gua sha or other forms of facial massage can be helpful. Because facial massage can help redistribute fluid in the face, if you're someone who tends to be quite puffy, that constant fluid buildup in the face can weigh the face down and start to emphasize those lines. And so by kind of moving that fluid up and out on a regular basis, you can improve your smile lines. Now, this isn't going to be dramatic. You're not going to get rid of an entire fold doing this, but small improvements is the name of the game when it comes to at-home treatments. Also, anytime you are massaging or lifting up a line, you're sort of preventing it from creasing, because people will be bothered by two different things, remember, the fold itself, but also the little crease that gets etched into the skin. And by stretching and moving that skin up and away and out of the crease, you can improve that. Speaking of those creases, another thing that can be really helpful and is only going to be practical for some of you is learning to sleep on your back. And I say this as a full-on side sleeper. I've never been able to sleep on my back, but if you're someone who can train yourself to do it, it really does help with how your face ages. Not just at your smile lines, but it can help with chest creases, neck creases. There are a lot of benefits. Now, if you can't sleep on your back and these lines really bug you, another thing you can think about doing is wearing silicone patches along your smile lines when you sleep. Silicone patches essentially act as a support mechanism for your skin so that when you are side lying, your skin doesn't want to fold or crease in on itself. Now, there are brands that make specific face-shaped silicone patches or ones that are meant for your neck or chest. You can totally use those. Usually I recommend to my patients just some type of silicone tape that you can get on Amazon. I'll link it in the description box. Now, I don't want you obsessing about things that you can do at home. Something I say to my patients all the time is do your best, but live your life. And if you are constantly at home trying to figure out ways to like smooth out your face or fix your lines or not age, that's kind of a miserable existence. But now I want to pivot and talk about things you can do in the office to improve these smile lines, because that's often what people are coming in for. Right away, I want to address the topic of using Botox in the smile lines. Every single day in clinic, I have a patient ask me, and this is not their fault. This is just, people don't know this stuff. They ask if they can use Botox to fix their smile lines. But the reason that doesn't work is Botox is an injectable that relaxes muscles. So when we think about why this line exists, it's because we smile. If I were to inject Botox to prevent you from smiling, you would not love the way you looked. It would look like you're having a stroke on both sides of your brain. So yeah, by far and away, the easiest way to not emphasize those lines is to never smile, but that's not really a practical solution. And sometimes I think people bring up Botox, but what they really mean is filler, so some type of injectable that takes up space or volumizes the tissue to sort of plump that area. And I want to caution about this as well. Filler absolutely has a place in correcting nasolabial folds or smile lines, but it needs to be done so conservatively. And the reason for this, remember, is that the primary cause of these smile lines or nasolabial folds is descent of the facial tissue. It's not really due to a lack of volume in that fold. So when I'm doing some type of cosmetic correction to someone's face, it's so important that we are only adding volume back in where volume is lost or where volume is missing. Patients always say, well, can you just like fill this up with filler? Oh yeah, I sure could. With a few syringes of filler, I can make your smile lines completely disappear. But when we step back and look at your face as a whole, will you actually look better for it? And this is something I talk to my cosmetic patients about all the time. Any cosmetic intervention that you're doing, whether it's Botox, fillers, lasers, tightening devices, you have to think about how it's going to affect the entire face. We don't treat features, we treat faces. If you just go in and put filler, so something that takes up space along those lines, very quickly you can start to look puffy. Some people will describe this look as simian or ape-like. And there are no patients who come into my office and say, Dr. Ellis, make me look like a monkey. And this educational point is something I always explain to my patients because I think they are very hopeful that they can just puff that line out. And it's so important that my patients don't look weird. I think they come to me because they understand that I have a very natural aesthetic and they're never going to look done. And one of the quickest ways to look done is to start volumizing lines and folds all over your face. These nasolabial folds or smile lines are a symptom of something greater, of the descent of the tissue. And if you are not addressing that greater problem and you are just treating the symptom, you're not going to get where you want to go. Now, I do want to say, like, filler absolutely has a place to be put along those folds, but there's a technique and a way that I do it so that someone continues to look natural and normal. So it's not about completely eliminating creases or shadows from the face, but just lessening how harsh they are. Now, over the years, there's been a lot of content put out on social media about, well, okay, if you're not putting filler in the nasolabial folds or the smile lines, should you put it in the cheeks to lift the tissue up? You have to have an injector with such a discerning eye to decide if you are the right candidate for that. In my experience, filler does not do a good job of actually lifting up tissues, but it can create the illusion of lifting the tissues if placed properly. But this should really only be done in people who have a flatter cheek or a less prominent cheekbone. Sometimes I have a woman with nice, beautiful, full cheeks, a high cheekbone, and she goes, can you just put filler here to lift this up? If I do that, you will just have alien or feline looking cheeks, and it's not going to help your folds at all. However, if you are someone that has lost volume throughout your face, maybe you've gone on a rapid weight loss journey, maybe you've just aged and lost volume in your face, replacing volume elsewhere in your face can bring more balance to it, and it really makes those nasolabial folds or smile lines less obvious and less prominent. So when I'm volumizing other parts of the face, I'm talking temples, cheeks, right in front of the ear here, there are so many places you can utilize volume strategically to make those smile lines less noticeable without directly injecting the folds. And if I do that to someone and you step back and you look at their face and you look right at their smile lines are actually not better. But because we've balanced the rest of their facial features, those smile lines are less prominent and they're not a distractor or a detractor on their face. It's so important to see an injector who's experienced, but also thoughtful in the way they are utilizing volumization to make you look better. And if you have any questions about filler in general or filler in the smile lines, definitely let me know in the comments. Aside from traditional hyaluronic acid-based fillers like Restylane or Juvederm that might be used throughout the face and specifically in the smile lines, another thing I like to do is use Sculptra, which is a biostimulatory filler in that area. I have an entire video dedicated to Sculptra, so if you want to know all the details about this injectable, I encourage you to check that out. But Sculptra helps stimulate collagen in the skin. So for all of my patients, but particularly my younger patients, maybe ones who are in their 30s, early 40s, who are just starting to see that line start, I often will use Sculptra in the fold and also kind of throughout the face to help give their skin a little bit of a collagen boost so that it is less prone to falling and sinking over time. And this not only helps with the smile lines, but can also help prevent some of the other lines and creases and sagging that they will inevitably see as time goes on. Ultimately, I would say filler is probably the best tool in our toolbox to help lessen those lines, but there are certainly other things we can do in office to improve the line, so I'll talk about those next. Especially when it comes to the quality of the skin and early signs of that smile line getting etched in, resurfacing procedures to help build collagen in the skin can be quite helpful. Laser resurfacing, microneedling, anything that we are doing to help build collagen in the area can help lessen that smile line as well as lines throughout the face. Now, these types of procedures, again, are really just working in the superficial tissues in that top layer of skin, so they are not good at helping with deep lines or folds. But it is not uncommon for people to come in and say, well, Dr. Ellis, what about radio frequency microneedling? I've heard of Morpheus 8 or Profound or Potenza, and they have told me that that really lifts and tightens the skin. Well, not so fast. In my hands, and honestly, when I speak to my dermatology colleagues across the country, not many of us have seen much extreme tightening from radiofrequency microneedling. I have one in my office. I think it's amazing for refining the pores and helping with acne scarring and helping with texture, but it will not lift and tighten the skin. I have never seen it do that. These companies do an incredibly good job at marketing radiofrequency microneedling as sort of filling that niche because everyone is really desperate for something that lifts and tightens because there's not much out there that does that, but it just really doesn't do it well. And I have had so many patients come into my office who have spent thousands and thousands and thousands of dollars at outside offices doing radiofrequency microneedling, hoping it will lift and tighten their jowls, their marionette lines, their nasolabial folds, and they've really seen no significant benefit. So I do think radiofrequency microneedling has a place in rejuvenation of the skin, but it's not really going to be the thing that changes your smile lines or the folds in your face significantly. Now, on the other hand, I do think skin tightening devices like SoftWave, Ultherapy, Thermage do have a small place when it comes to the improvement of these lines. I find that the best candidates for this type of tissue tightening are people who have excessive volume in the face. So it's not the skinny little faces, they're having a tiny little line. It's people who have heavy jowls, bigger cheeks that are weighing down their face and creating those lines. Because with some of these tightening devices, you can actually get some local fat reduction if you pick your settings. I know people get worried about using these tightening devices and it causing atrophy or dying off of the fat, but when done strategically in places where you sort of have excess or irregular distribution of the fat, it can really help with the improvement of the smile lines as well as the jowls. But by far and away, the thing that is going to give you the best benefit in your smile lines is something that actually lifts the tissue. Because another thing a lot of patients do when they're coming in and talking to me about their smile lines is they do this. They put their hands at the periphery of their face and they pull back and their smile lines kind of disappear and they go, I just want that. Well, unfortunately, in dermatology, we don't have a ton that's going to do that amount of significant lifting and tightening. That is multiple millimeters of lift, if not over a centimeter, and nothing has been shown to do that. Threads are something that are marketed as having the ability to lift the tissue, and you do see it do that. However, in my experience, and over the years watching people get threads and then come into my clinic, you get a very temporary lift from threads. So you might look amazing for a few weeks, but patients end up disappointed because their skin eventually and inevitably sags back down quite quickly. And this would be fine if threads cost a few $100s and weren't particularly invasive, but getting threads is actually kind of a big deal and it's usually quite expensive and it ends up just not feeling worth it to so many people. Ultimately, the best way to get rid of your smile lines is to get a surgical facelift. And this is something that no one really wants to hear me say. I know you come to a dermatologist channel to be told about the non-invasive things that can help, and I've done that. But the reality is, because smile lines are so much driven by descent of the tissue, eventually the only way to fix them is to pull the tissue back up where it started. And if there were amazing alternatives to facelifts that did exactly what a facelift did and improved the skin and the shape of the face the way a facelift does, facelifts wouldn't exist. But there is nothing that rivals what a facelift can do. And so ultimately, if your smile lines really bug you, but I wouldn't just do it for the smile lines. If you're also noticing lines around the face here, you're noticing jowling, you feel like your neck is sagging, that's where surgical interventions are really going to do the most. And a facelift certainly doesn't last forever, but of all the interventions I've talked about, it certainly has the longest lasting effects because you're really taking that displaced volume and replacing it where it needs to go. And so many patients end up in my office too, and they're like, look, Dr. Ellis, I'm never getting a facelift. And that's completely fine. Like, getting a facelift is not just like a normal thing that everyone goes and does or can afford or wants to take on that risk. And like I said, there are many other things we can do to improve these lines, but there is nothing that's going to give you the same result as a facelift. I hope this video has helped you and provided you some guidance when it comes to smile lines. If you liked it, please give it a thumbs up and don't forget to subscribe to the channel. I'm so curious if any of you have tried things to help your smile lines and what has worked for you, so please share in the comments. I'll catch you next time. Thank you so much for being here.